Exoskeletons aside, is this why ants are able to lift 6 times their body weight or something preposterous of that nature? Because they're full of turkesterone? All right. And what are these bug and plant steroids, the ecdysteroids?
Yeah, so I can't tell if bug and plant steroids are extremely overrated or extremely underrated. A lot of our like both friends and favorite influencers have made videos about these or even have their own supplements, but these are turkesterone and beta ecdysterone. And one thing that we like about these is they have a relatively well characterized or relatively well theorized mechanism of action. They bind the beta estradiol receptor.
Yeah, and exoskeletons aside, is this why ants are able to lift 6 times their body weight or something preposterous of that nature? Because they're full of turkesterone?
Probably not. But I guess it might not hurt. But in general, there is a group or a patient population that theoretically could benefit a ton from ecdysteroids. And these are people that are in estrogen deficient states or especially on high doses of aromatase inhibitors. So you're thinking about postmenopausal females also on an aromatase inhibitor, or someone who has to take a really high dose of an aromatase inhibitor. I can't think of many other scenarios, but there's certainly people that are.
Yeah, and on the, there's a lot of examples on the, female side. Looking at, I guess, an even more specific niche, if you look at men with, let's say, prostate cancer on androgen deprivation therapy,
Yep.
They, in theory, should have quite a low level of estradiol because they have a low net level of androgens. And if you're looking at the sarcopenia that happens there, if you can agonize that estrogen beta receptor with something like an ecdysterone, then that may have a positive effect. Not necessarily on the cancer, that's really difficult to say, but on at least their insulin sensitivity, lean body mass, and sort of everything in that sort of under that umbrella or in that bucket.
Bioidentical estradiol certainly is used for therapies in some prostate cancers, but it's unknown. And not to get off into too much of a rabbit trail, the ratio of estradiol alpha to estradiol beta receptors in the prostate, which is largely genetic, also determines a lot of the predisposition towards prostate cancer. That's why something like raloxifene, which is basically an agonist in some receptors and an antagonist in some receptors, might slow the growth of prostate cancer or make it slightly less likely to develop, but have a lot of other side effects as well. All that to say, something that is just a beta estradiol receptor agonist is probably not going to have a huge benefit, but that receptor is in muscle tissue. So for those individuals, breast cancer, prostate cancer on aromatase inhibitors, potentially very underrated.